Hi, I'm Katie. I'm going to show you how to set up phototherapy for your baby. When your clerk orders the equipment, 3 pieces should show up. This incubator, a phototherapy blanket. This is the box. The blanket piece may or may not be attached when you arrive or when it arrives, but I'll show you how to set it up. And an overhead light. We do triple phototherapy here. The underneath blanket is the first source. And on your light, you've got 2 sunshines or 1 sunshine. You do the 2 sunshines, which indicates double light. So 1, 2, 3 triple lights. Your incubator will arrive with a piece of plastic on it, letting you know it's clean for your baby. To open the incubator, there's these little tabs on the side that you pinch. Set it down lightly. If you drop it, it'll snap right off. Grab a baby blanket to line the mattress. Sometimes you'll come into your patient's room and you'll see that the previous nurse had set up 2 blanket rolls on either side to prevent the baby from rolling. The suffocation risk is greater than what would happen if the baby rolled over. So please do not put blanket rolls in the incubator. That is set. Next, we'll get the blanket into the incubator. There's a window back here, goes down into this slot here. At the top, there's a nice hole. Now lay your blanket down and feed this chunky cord through here. You can kind of push the cord down into the slit and close the window, and that'll help keep your temperature stable in there. If the blanket piece was not attached to the electrical box, there's a large black hole in the back, a large black cord goes right in, and then there'll be a little metallic slide holder that you can keep the blanket box mounted on the side of the crib or incubator. There's 2 power sources for the incubator. There's one back here. Oh, I turned it on, nothing happened. What's wrong? It's because there's another on-off switch back here. There's a power strip the incubator's plugged into, so make sure your power strip's on first. That. And then I'll turn it on right here. Preparing your baby to go into the incubator, you're going to remove any lotions or oils that might have been on his skin. You're going to check a set of vitals before you put him in at 30 minutes, at 60 minutes, and then moving forward, he'll continue to get Q4 hour vitals like all of our babies with an additional Q2 hour temp. While this warms up, I'll tell you if the parents need to console the baby, they can pop open one of these little holes, reach in. Oh, it's okay. However, for taking him in and out, they'll need to open the sides and tell them not to let it flop either. They can take the baby out. Make sure they close it back up after the babies come out. The baby will come out for feedings or diaper changes. If they leave the side of the incubator open, the incubator will misunderstand and the cool room air will come in here and the machine will try to heat the whole room up to whatever you programmed it to, and it'll just be a big overheating mess for hours. You're going to program your incubator to a setting that's individualized for your baby, his weight, his gestational age, and his postnatal age. So I've got a baby coming into my care soon. I'm just going to use his information. Up here's your menu. This wheel turns to move along and select different things, and you push it in to actually choose something. So, a little closer. Oh. So you start with options. You're going to scroll over here to the little thermometer with a happy face. It's called the comfort zone. You want your baby to be comfortable and happy. You press it to select it, and then you get another menu asking you for information about your baby. First thing you're going to enter is a weight. It's not specific, they have ranges. Most of our babies will fall into the last cachet of the ranges, which captures 2,600 grams to 4 kilos, which is where most of our babies will shake out. This baby that's coming to me is 30-35, so he definitely fits there. Next is gestational age. So choose your correct range, go down to gestational age, like that. This baby was 37 plus 3 weeks. The gestational age range is kind of the same. Everything greater than 36 weeks, it'll capture, which will be, again, most of our babies. And then finally is postnatal age. How many days old is he? He's 1 day old. So I've programmed all my things. Next up would be done and exit. Before I hit done and exit, I'm looking down here to note the safe recommended temperature range for this baby. It's 29.5 to 33.7. Over here is your buttons. Down here is what you're asking it to be, and these fussy buttons will let you request that. And this is the actual temperature of the incubator. So when these guys match up, you can put your baby in. The bottom end of this range is 29.5. I can guarantee you, you're never going to have a problem with this incubator being too cold. It's going to be too hot, if anything. So I always err on the side of the low end of the range. The bottom range here is 29.5. So I chose 30 degrees Celsius for this baby. Obviously, if he's having temperature changes inside the incubator, you can adjust it within that range to suit his needs. So we've got the blanket placed. Gonna plug it into the power strip back here. It doesn't have to be the power strip. You can plug it into the wall. It's off. Now it's on. When you come in for your shift, if your baby's on phototherapy, do yourself and your baby a favor and turn off the overhead light for a moment and confirm that the right side of the blanket is facing up. One side doesn't glow. He's not going to get any treatment if he's on that side. So make sure the right side's facing up. Next, you're going to cover this with a blanket cover. And then we'll get this little dude ready. I'm not sure why these blanket covers have these dangerous strappy things on the back. I took them away to prevent any further choking hazard. I guess you could just cut them off if you wanted. This just slides on there. If it gets soiled, change it. So there's that. Phototherapy works because the UV light helps break down the bilirubin. So we want to obtain maximum skin exposure. Lost a layer of my incubator here. So under the lights, baby should just be wearing a diaper and a face mask. The masks that we have on the floor usually fit our babies, and they have blue ink on them. If this doesn't fit your baby, it usually would be the case that it's too small. You can call down to the NICU, and they have ones with orange ink or green ink, and those are suited for their preemies, which is sometimes our late pretermers. To place it, I will lie this across his face sort of gently. Hold it in place on his cheeks. And then you have two straps that come around the back. One should go over top. One should come around the bottom, so he kind of looks like Jacob Marley back there. These will slip down, they will slip up, they will do crazy things, but importantly, as long as his retinas are protected, you're okay. Parents will probably need help with this. offer to help them and be prepared to have to place it for them every time because some folks just are too nervous. All right, so we just fast forwarded to this incubator being ready. It usually takes about 20 minutes. So I'll pop in at 15 or 20 minutes and see where we're at and keep popping in until he's at the recommended temperature here. I confirmed he doesn't have any lotion or oils on him, and I checked a set of vitals. Baby should spend as much time as possible under the lights. That's how it works. So encourage your parents to keep them under there as much as possible. I think I'm gonna pull out just a little bit so I can show lights not touching the top. Your overhead light needs to get plugged in as well. Same thing, you can plug it into the wall, or if you've got a port on your power strip back here, you can use that. So I'm doing my best to center this over him. And then you want to get this surface as close to this surface as you can without it touching. If this plastic touches the incubator, your incubator is definitely going to overheat. So get real close. Lock it in place. And then over here, I've got my on off. I'm going to double check that I've got the 2 sunshines instead of 1, so it's double overhead. And off we go. Once upon a time, the hospital ran out of incubators and nurses didn't know what to do. People were holding phototherapy because they didn't have an incubator. People were starting phototherapy even though they didn't have an incubator, and nobody knew what to do. In 15 years, that was the only time this has happened. So I don't think it'll happen again. But if it did, the official word from PEDS is start phototherapy in an open crib top with the blanket underneath, the light overhead. You grab a tape measure and you measure 12 inches from the baby's abdomen to this surface. And that's how close it should be. And obviously you keep working and partnering with your clerk to get an incubator onto the floor as soon as possible. Thank you.